Cancer's scary. Cancer can be very scary. You do not know what will happen on your cancer journey. You do not know whether you will survive. I was first diagnosed at the age of 40 in a totally unexpected piece of good luck, I guess. I'd had an ulcer on my tongue, which had refused to heal over a period of 6 weeks. My local dentist then sent me off for further investigations, and unfortunately it revealed a tumour. I am very lucky. I have been diagnosed early on 3 occasions, and the treatments that I've received have been curable. They have cured my cancer. Most people with oral cancer are diagnosed at a much later stage, and the survival rate is generally 30% of all cases.
Oral cancer affects regions of the mouth. So you have your lips and you have your gums, so cancer cells can appear there as well. You also have cells that can appear on your tongue itself. In Australia, around 4,000 cases are diagnosed annually. Worldwide, the problem is more significant. There are around 300,000 cases diagnosed annually. There is no early detection tool for oral cancer at the moment. The only way that oral cancer can be detected readily is through a biopsy. The great advantage and the idea that we had for our assay would be it would be less invasive, so it wouldn't require the patient to have a biopsy. The patient, if they suspected themselves of having oral cancer, would go to the doctor. The doctor would take a routine blood test, and within that blood test, we would isolate a component of the blood known as serum. And within those serums, it would contain our 6 biomarkers. So the serum or the blood is then shipped to a diagnostic lab or a lab within the hospital. So the hospital then would administer our kit, okay, for the detection of these 6 biomarkers. We're really excited about this because it fills a void. So patients now have the ability or the choice to have these tests, which will tell them if they have early stage cancer. So the vision that we have for this assay is that it's going to be used as a first line of screening for patients.
I'm very hopeful about cancer research at the moment. A breakthrough like this that has come up with a tool that can be used to diagnose people early is just an amazing step forward. I'm hopeful that there'll be many more attempts to get funding and go down that path as quickly as possible.